Hey everybody, I'm Robert Levy, registered massage therapist and instructor of ligamentous articular strain technique. Thank you so much for being here with me today. I'm here to tell you about the Canadian Massage Conference, live and virtual event happening in September. It's amazing. You're going to want to be there. I'm going to be there. All of these amazing guys are going to be here. This is a fantastic conference that you guys don't want to miss. It's happening when? September 24th to 26th. I'm going to be there live with you guys in the chat room answering all of your questions. If you were with me in July, I taught you guys ligamentous articular strain techniques for the knee. Now we took more of a fascial perspective in looking at treatment techniques for the knee. And what we looked at is we looked at popliteal fascial tissue. We looked at how to treat the anterior meniscus. We also looked at articularis genu, the inferior patellar fat pad, and we also looked at the patellar ligament. So that was actually part one of ligamentous articular strain techniques, looking at treatment techniques for the knee. Now coming up in this September conference, this is going to be part two. So once you register for the Canadian Massage Conference, you're going to be able to go back and watch that part one. If you weren't able to be there with us for part one in July, you can go back, you can watch that, you can get all the information, you can watch all the videos, start applying those techniques to your patients so that when you come to part two, when the conference happens, you guys will be all ready to go. So in part two, we're actually be looking at a little bit more of the most common ligamentous structures of the knee that come into our office that typically get injured. So we're going to be looking at treatment techniques for the medial collateral, for the lateral collateral, for the anterior cruciate ligament, posterior cruciate ligament, and just a general cruciate ligament treatment techniques for that. As with everything, with all of my courses, we always talk about ligaments. We talk about their properties, so they have sensory and mechanical properties. We talk about their neurological innervations and their typical referral pain patterns. We got to talk about what happens when they get injured and their healing times, because the healing times are not what you got taught at school. We talk about some armoring that happens. That's why Iron Man's there. There's a protective mechanism that comes into place when there is an injury or a potential injury that happens. We've got the healing times I talked about before. We also got to talk about, you know, what we say, how we say it, the environment that we create, and what we do with our hands, and how those both blend together in order to create our outcomes with our patients. I've got some treatment techniques again for the ACL, PCL, MCL, and LCL for you guys. And then we got to talk about what some expected outcomes are for our patients. So again, this is going to be the Canadian Massage Conference. It's an amazing conference. I have been so blessed and honored to be a part of this conference for almost a decade. It's been fantastic. And the guys and the girls that presented this conference, they are some of the most innovative and progressive thought leaders and clinicians in our profession. So you don't want to miss out on this. Again, go to this link, take a screenshot, go to the link, and you guys will get a discount, I believe, if you register through that link. So can't wait to be there with you guys. Going to be live in the chat room answering all of your questions. Once you're registered again, you get to go back and watch part one. You want to watch part one of the knee, start putting those treatment techniques into practice with your patients. Let me know how you did with that. Show up for the conference, watch the videos for part two when we look at the ligamentous tissues, and then I'll be able to answer all of your questions in the chat. So thanks again for being here. Can't wait to see you guys all there, and have an awesome time. Thanks, guys.